I'm Dr. Srinivas, Chief Urologist and Transplant Surgeon, Kamineni Hospitals. Briefly to mention about renal failure implies that majority of the function, of nearly 90% of the kidney function has deteriorated, so the patient cannot survive on his own with his kidneys. In this situation, the options in front of him are dialysis or undergoing a renal transplant. Dialysis, you have to undergo dialysis thrice in a week, and you have to spend about 6 hours in the hospital. Long-term cost of the dialysis are more when compared to a renal transplant. Renal transplantation, the advantage is you can lead a normal life. There are no frequent visits to the hospital, and you can be like a normal person, taking all varieties of foods and what a normal individual does. But the problem here is about the donors. In the present era, present day, you don't have too many donors coming forward and donating the kidney to the person who is suffering. Eventually, ultimately, it has the family persons who have to come forward and donate the organs. But unfortunately, in majority of the situations, we find that the blood group of these two individuals or the family members are not matching. So this was a great deterrent as far as the transplant was considered. Nowadays, we are trying to overcome this problem of incompatibility, that is blood group incompatibility. A person cannot donate to O person, a B person cannot donate to O person, B person cannot donate to A person, A cannot take a B. So there are lots of these particular problems. Now with the technology that has been used and done a successful transplant, it is called as ABO incompatible transplant. In this procedure, before the transplant, a particular individual, that is the recipient of the kidney, will undergo dialysis and filtration of his blood with a special technology wherein the antibodies which reject the kidney have been absorbed, removed, and to prevent further antibody formation, he is given a special injection which will take care of further antibody production. Later, once we confirm that the antibodies levels which reject the kidney in otherwise situation are drastically low in his body, at that moment we do a transplant, and this transplant will take up like any other transplant. That's exactly what happened in this particular case. 1 month back, we did this ABO incompatible transplant using immunoadsorption technique in our hospital and did a successful transplant. There is, the only here what filter we are using, we only remove those antibodies which reject this particular kidney. So by doing this, you are not going to have any significant side effects. No, normally in our hospital, every week we'll be doing 1 or 2 transplants, but this ABO incompatible transplant, this is the first time we are doing. And with this technique, this is the first time that is happening in our country. Henceforth, with the success of this story, we look forward to doing many more such cases.